Okay, this is the Burleigh County Human Service Zone Board meeting for March 19th, 2024. Our first, or I'll call this meeting to order. Our first agenda item is the oath of office for Commissioner Bakken, and we have County Auditor Mark Splankowski here to walk us through that process.
All right, thank you very much. So I'll just have Commissioner Bakken come up here and we'll administrate the oath and we should be good to go.
All right.
I, Steve Bakken,
I, Steve Bakken,
do solemnly swear
do solemnly
swear that I will support the Constitution of the United States
that I will support the Constitution of the United States
and the Constitution of the State of North Dakota,
and the Constitution of the State of North Dakota,
and that I will faithfully discharge
and that I will faithfully discharge
the duties of the office of Burleigh County Representative to the Region 7 Human Services Council
the duties to the office of Burleigh County Representative of the Region 7 Human Services Council
in the County of Burleigh in the State of North Dakota,
in the County of Burleigh in the State of North Dakota,
according to the best of my ability,
according to the best of my ability,
so help me God.
so help me God.
Jump.
There you go. Can you sign that?
Yep. All right, thank you.
All right, thank you, Mr. Splankowski, and Commissioner Bakken, thank you for being a part of the board and supporting us in this work. Tayan, can we get a roll call of members?
Okay, we will start with Galen Becker,
Here.
Senator Dever,
Here.
Jim Holm,
Here.
Leslie Piercy. Here. Trevor Van Eff,
Here.
Tracy Famous,
Here.
and Commissioner Bakken.
Here.
And for the record, Director Flory is absent.
Next agenda item is approval of the minutes from December 19th, 2023. Has everybody had a chance to review those minutes, and does anybody have any question or need for discussion?
Yep. Fourth line, an oath of office. It's Baker instead of Bakken.
Thank you for that.
Okay, any other comments or discussion? Okay, hearing none. Do I have a motion to approve the minutes?
As amended.
Yes. Move to approve as amended.
Second.
All in favor, say aye.
Aye.
Any opposed, say same sign. Okay, minutes are approved. Moving on, we have the director's report. Up first is our Economic Assistance Unit, and we have Gray here this afternoon to share her report. Welcome, Gray.
Hello, how is everyone?
Good.
Good. Okay, so I do have an outline here. I'm just going to read through. Am happy to report that we are still fully staffed. Right now, there is a training initiative for call center staff that has been started. Call center has asked for collaboration with Health and Human Services to improve their onboarding quality and to provide the training that many of the call center staff need in order to fully answer the questions that clients are calling in with. Burleigh County is willing to help, and we are currently training a few virtually right now. Also, we have some pretty big changes that are starting on April 1st. And I think you guys are pretty aware of how our groups are set up, but I'm just going to give you kind of a brief overview to begin with. Group 1 is our Medicaid-only cases. Group 2 is our SNAP Medicaid-only cases. Group 3 is our SNAP Medicaid Child Care LIHEAP cases. And then Group 4 is all of the above plus TANF. So if they have TANF attached to their case, they're in Group 4. So what the changes are, I will mention that we are all in support of the decision of the changes. But with the LIHEAP season that began on October 1st, this is typically when everyone starts applying for the LIHEAP for the new season. And with that this year, we did begin to, Group 3 with the LIHEAP began to fall behind in getting the applications processed timely due to the volume of the beginning of the LIHEAP heating season. At one point, we were roughly about 2 months behind in processing applications. We've gotten a lot better with several of the initiatives that we have taken in the meantime. But LIHEAP administration is currently working on making some significant changes with the LIHEAP program. However, they are still only in the beginning stages of it, so no information to give on that as of right now. Recently, the state did initiate what they call March Madness. This will likely spill over into April, but it's just an initiative to help get Groups 1 and Groups 3 applications and reviews caught up. Our eligibility workers have been offered comp time to work extra hours on this project. We do have some that are currently working on the comp time. With this change, Group 3, and because of all this, Group 3 is actually going to be losing the child care program, so they won't be working any cases that have child care attached to them anymore. And Groups 2 and 3 are going to be merging into one big group. So this one big group will then work SNAP, Medicaid, and LIHEAP cases. This is being done to level the amount of workload that the heating season brings with the LIHEAP program and having more available eligibility workers to process the applications. Right now, training in LIHEAP has already begun for the Group 2 eligibility workers. We do have quite a few that have never worked LIHEAP before, so we are training them. They have already been asked to complete the training on the PeopleSoft, and then we have trainings that are going to be held by our policy and system support during the last week of March and first week of April. And with that, also our region's Group 3 leadership team is also conducting more hands-on watch and learn type trainings as well with them. Child care, since it's being removed from Group 3, is going to be moved to Group 4. Right now, Group 4 is viewed as having the most capacity with the amount of eligibility workers versus the amount of work items that are being assigned to them. Already, processes with the child care program, they already know the child care program because they have those along with theirs, so there's no training that needs to be required for Group 4 workers on the child care. Just also, it will be reevaluated at a later time, the impact of the increased volume of adding the child care to that group when determining if more eligibility workers are needed to be added to that group at that time. Some changes with the child care program also happening on April 1st. Child care is going to be moving to an 18-month certification period, whereas right now it's at a 12-month certification period. This actually began the month of March with the reviews that are being received in the month of March for the benefit month of April. These changes are expected to take place. There are other changes that are expected to take place in June or July, but again, they are also still in the beginning stages. And so we don't have a whole lot of information to give on those as well. We do know that some of these changes could likely impact the volume of the cases at that time. Recently, Deloitte came to Burleigh's office to run some SSP testing, and the SSP is our self-service portal. They spent the day at the Bismarck office here working with clients that came in, helping them set up their accounts on the SSP, walking them through the functionality of the SSP. They were doing some other kinds of testing, but as of right now, we have not received the results back yet, so I'm sure Chelsea will inform you when we get the results back for that as well. There's been a big push across the state for zone offices to once again have the ability to issue EBT cards. This is being considered, but as of yet, there's no timeline of when it may happen. I know Chelsea's in favor of this as well, as I think most of us are too. Let's see, the state has implemented setting benchmarks as guidelines for all workers to follow and to improve consistency. There's been a dashboard that's been created on Power BI, and it's a tool for supervisors to be able to use to monitor the work of their workers coming in and the items being completed. It's also for us to have better access to the unassigned work items to be able to supplement work queues that may need some extra work added to it. The dashboard can give many insights into the amount of applications being submitted and the timeliness of processing, how the workload is being distributed, as well as areas that might cause for concern or need correction. And the last bullet item I have, she wanted me to talk a little bit about the economic measurements that are being created. Measure 6 is human service zone eligibility teams are complete. Measure 6 is to measure how eligibility zones are completing at least 75% of the target number of work items each month. And Measure 7 will be used. At least 95% of the applications and reviews are processed within the established timeliness standards. More information will be provided when this is closer to being presented. And of course, this information is contingent on the system working properly and the workload being spread out equally.
Does anybody have any questions for Gray?
I just have a comment, I guess. I was one of the clients that did the testing for the SSP, and I think it'll be very beneficial if they do some of the recommendations that the clients have. I think it'll be helpful, so that's my only comment. Thanks.
Thank you for your input.
Yeah.
Okay.
Any other questions for Gray? Okay, thank you, Gray.
All right, thank you.
Yeah. So next up, we have an update on Child Welfare Unit, and we have Jeremy to share out that report.
Good afternoon. I'm Jeremy, for the record. I'm just going to start off with the child welfare in general, because then I'll be talking about different specific units a little bit later here. But for some of our planning efforts and things like that, what we're doing for child welfare. So recently, motivational interviewing has been kind of pushed out to the different regions, and we were identified as one of the first zones to bring in motivational interviewing. So motivational interviewing is a evidence-based practice. It's a communication technique. So when behaviors happen and occur, some individuals are not aware of their behaviors. And motivational interviewing is more of a non-judgmental communication technique to help support them and move them along into different behavioral changes. So we're rolling that out within our zone here. Staff crisis response. The way our staff respond to some of the crisis, sometimes secondary trauma might occur, and right now we have the EAP system, right, for the Village Family Service Center. That's more of an individual professional counseling service. And then we have HHS contracting with David Conrad with University of North Dakota. That's more of a prevention and educational piece. Now we're rolling in CISM. It's called so crisis intervention, critical incident stress management system. Right now, it was currently rolled out to first responders, so law enforcement agencies, ambulance services, and fire departments. I worked recently with Alan and Dwayne with the Health and Human Services that kind of oversee that emergency response CISM program, and kind of described situations that we go through sometimes when we are responding first. Sometimes we respond before law enforcement agencies, and sometimes we respond with law enforcement agencies, and sometimes we respond after law enforcement agencies. But ultimately, our staff are exposed to a lot of the same situations. And the CISM, critical incident stress management system, is more of a peer support. With that being said, we don't have any other zones participating. However, a couple weeks ago, I asked Dwayne and Alan to also present to the other zone supervisors, and a lot of those zone supervisors are looking at it and hopefully going to participate as well. So we'll have some peers there too. But in the meantime, since we don't have peers, we might tap into the law enforcement peers as peers, fire department, and the ambulance. So I'm hoping that that will be another great addition. So measurements, we all have standards that we have to abide by and work with, and there's federal standards and there's state standards tied to our funding, right? We have been aware of it, and we have been tracking a lot of these measurements already for quite a while, and we are in compliance. However, now the state is making all the zones accountable, so in the next year, they'll be reviewing reports, sending out reports to different zone directors, and the zones will actually see where they sit with the state. So what I did is I created to make it a little bit more formal and showing the expectations to our staff members, I created kind of a visual chart. I don't know if we have an illustration of it right now. Okay. All right, so I can get that sent out to you guys if you all want to see the illustration, but it's a nice kind of colorful table that breaks it out into CPS, Child Protection Services, foster care, case management services, and then in-home case management services. There are all standards that we have to abide by that's tied to that state and federal funding. Next is we're working on targeted case management services. So we're planning some work with the state. Essentially, we are already doing the service. It's case management services, right? And right now, our case management services is tied to state funding, so general funds. However, our foster care kids, a lot of our youth that are in foster care are eligible or enrolled into Medicaid services. Targeted case management is a Medicaid service. So instead of having state funding dollars paying for this case management services, now we would leverage the state and federal funding for our case management services. So we're just working with the state to try to move over to under that targeted case management piece. I'm working with my trainer. We identified a trainer a few months ago. We're working on transitioning her from a foster care case manager into the training position. We are very, very close to getting her into that full-time training role. And right now I have that priority set for that kind of that person-centered professional development. So based on where the needs are, and where the needs are and the competency levels for the staff members, I'm working with a trainer on identifying those areas. We have a child welfare state's attorney, Mary. We've been working with her on court processes, and we've got a lot of new staff here in the last couple of years. And they really hadn't had a lot of training in preparation within the court processes. So she's already provided 2 trainings for our staff, all of our staff, and she's going to bring in a 3rd training here in a couple weeks, and that's kind of going to be a mock hearing. And the mock hearing will, hopefully, if everything turns out okay, will consist of a current practicing defense attorney. So we'll have the state's attorney, and then we'll also have a current practicing defense attorney that will create a kind of a mock hearing and provide help and work with our staff members. We continue community stakeholder collaboration. Just recently, we met with the chief and the new detective for Lincoln PD. She's also the new school resource officer as well. And we're collaborating. We've had a few different meetings with them. We continue collaboration with local law enforcement agencies. We just sent a large group of members to the Burleigh Morton Detention Center to participate in the first aid CPR training. So thank you for Burleigh and Morton County Detention Center for that. And we continue to work on a monthly basis with school social workers, administrators, and visit about cases that we just need to create a little bit more collaboration and communication with the complexities involved in that. We also provided a training to school workers. Some of the school workers asked for a training on our safety framework practice model. Our safety framework practice model continues to evolve. So what we did probably 2 years ago isn't probably what we were doing right now with our safety framework practice model. So the school workers just asked for a kind of updated, revised training on that. As needed, we continue to work with the North Dakota Region 7 Foster Parent Association. We collaborate with them on a monthly basis. And the Children Advocacy Center, we continue to attend those advisory council meetings and case reviews for, which is a multidisciplinary team approach to review. So that's all of child welfare, so on a higher level planning process that we do on child welfare. Any questions so far for the child welfare area?
I do have one question related to the standards that the state is working to hold you guys accountable for. Do you know if any of the recent surveys that went out to stakeholders are baselines for that accountability or tied to any of that accountability?
So the recent surveys that went out, it is, but it isn't. It's part of our federal CFSR, so it stands for Child and Family Services. It's a federal review. Okay. On a rotating basis, the federal reviewers come in, and part of the 4 rounds is getting the stakeholder comments and stakeholder feedback. So it's part of a kind of an auditing process by the federal government to the state, then down to the zones. But it's not directly related to those actual standards, but they will review some of those standards as well.
That was a difficult survey to complete as a stakeholder, and it left me feeling like my zone would be unfairly judged because I wasn't qualified to answer most of the questions as a foster parent related to timeliness in certain expectations around the work that you guys do.
Sure, and just to give you a little insight here, I or Chelsea, Director Chelsea, sit in on a lot of work group meetings with the state, and that was discussed, because I did the survey as well, and it was long.
Yes.
It was very, very long, and a lot of verbiage and a lot of terms that's not part of a layman term. And we discussed that, and according to the state, because I didn't get to see what is rolled out to a biological parent or a person with lived experience, but according to them, they have a lot smaller survey than what the community stakeholders had to do. So hopefully that's true.
Yeah, I hope so too.
Yeah. Anything else? Okay. Moving on to child protection services. So the CPS assessments that we do across the zone within our community. Right now, we're focused on process improvements to increase that timeliness and the efficiency of completing those CPS assessments. I think you received a report on that. And as you can see, our CPS assessment, the number of CPS assessments does continue to rise. Based on that and our FTE, so working capacity, we've worked with Dakota Central Human Service Zone and South Country Human Service Zone. They agree to take at least 6 cases per week for 3 weeks for within a month's time for a few months. They want a week break because they're also helping Cass County as well. So right now, in the month of February, they've taken 20 cases from us. So they've done 20 CPS assessments for us. Some are closed already. Some are in the process of being assessed still. And then in the month of March, as of today, they've taken 12 cases for us. Because of our overwhelming CPS assessments that do come in as full assessments, we requested a FTE position from the state. They approved that FTE position a few weeks ago, so we're in the process of advertising and hiring for that position. So that's all of CPS currently. I also, one of the major changes with the timeliness and efficiencies is for the longest time, supervision, program supervision was kind of that canned approach, and it was not individualized. Everybody got the same type of supervision on an hourly basis, things like that. We're working with the CPS supervisors on that person-centered approach based on competency levels, based on the amount of assessments that are within the individual. So supervision to one individual might look a little bit different to another individual now. And in the last month, we've been trying to transition into that person-centered approach for supervision. So. Next is in-home services. So in-home services, we continue to rise in numbers there. If you look at those numbers, one of the biggest issue and one of the biggest things that I've been working with is getting a lot of those cases or families moved into in-home services for case management services earlier than later. With a lot of general practice and standardized practice, a lot of times in-home case management doesn't happen until after CPS assessments are closed. But when we can clearly see that there's a need for case management services during the CPS assessment going on, whether it's 30 days, 60 days, 90 days, I've been pushing for them to make those referrals into in-home services. So you see a very high rise into those cases. As a result of that, we requested another FTE from the state, and we also got that approved. So we're in the process of recruiting and in a hiring process for that in-home case manager as well. And as a result of that increased case management services for the in-home, we also gained a statewide FSS. So what they do, field service specialists, what they do is they advise us on policy. They're their policy advisors. We only had one FSS for CPS and one FSS field services specialist for case management. So they had to do all foster care and all of in-home. Because of our rise in caseloads, they've added a second policy advisor for us as well. So because we're using them too much, I guess. Our quality audits that happen from the state under the QA unit continues to show positive remarks and feedback to us in those areas where we get those quality audits. So I just wanted to point that out. For foster care services, so for foster care case management, we are securing permanency a lot sooner than normal. As you can see in those numbers, our foster care numbers are lowering. We're closing more than we're opening now. So when we take over custody of a youth or siblings, we're getting a lot less than what we're closing now. So when I say securing foster care or securing permanency, it might be through the return back to home with the biological parents or biological family or any family members or adoption. So securing permanency means both things. Right now, we don't really have a caseload leveling system. There really isn't a caseload leveling system within the nation. There's a lot of research that's being done, best practices that's being done, but they really have not looked at how many cases per case manager should be done. That's mainly due to complexities of the youth, of the family members. So just to give you an example, an individual or a youth with serious emotional disorder, SED we call it, or serious behavioral issues might need a little bit more services from our case manager than an individual without a SED concern. We have youth with chronic medical issues. We have youth that are hospitalized and are in residential care. And then we also have youth that work, we call it dual status. So they're either with the Police Youth Bureau, they're with juvenile courts, or we work directly with the Division of Juvenile Services. All of those adds complexity to our youth, and it requires more work for that one case manager with that youth. So right now I'm working on measurements because the state has not created that yet. So I'm in the process of kind of just creating our own methods. And it's kind of worked so far with our case managers, and we're currently trying to even out caseloads. So when you see a case manager with 25 cases or 25 youth, and another case manager with 15 youth, that could be equivalent based on the complexities of those children. Lately, there was an adoption redesign that occurred. We were fortunate to have a worker, a supervisor, so a foster care case manager supervisor that was part of the work group that started in August 2023, and the state identified and understood that there wasn't standard care for adoption. There was not standard recruiting happening across the state, things like that. So they asked our staff to be part of that redesign work group to help lead that effort, and they were done. They completed back in February 1 of 2024. So they enhanced the referral process, the referral paperwork and process, the relative searches, the consistency of termination of parental rights. So in order to have youth adopted, termination of parental rights needs to occur. That wasn't happening in a standard way across the state. So a lot of those things just kind of came up and was developed and spread out to the state back in February 1 of 2024. Another effort that happened with the adoption redesign was Reel of Hope. This Reel of Hope basically created video of individuals that may have not been successfully recruited. So they might have been within foster care for a year or 2 years after the termination of parental rights has occurred, and we're just not successful in recruiting efforts. So our first Reel of Hope occurred actually from Burleigh Human Service Zone, and we sent out that video statewide, and we actually had 100 interested parties to potentially adopt this individual.
You need to tell them what the average is for inquiries on a child.
Average of
Yeah.
increase.
Paint the picture for the magnitude of that right there.
Well, yeah, it depends on if we have to recruit, very, very little. I don't have the exact number. Do you? But
I'm
it-
trying to
it- it
remember
is.
what I heard. It's like 7 or 15 is normal. So huge.
So, yeah, huge difference. So if you go to that Reel of Hope website, there's, I think, 5 videos right now that are actively being recruited. Hopefully, we'll find a home eventually here soon. A pair of siblings, and then 4 individual kids, 3 or 4 individual kids that are on that site. Not all from Burleigh County, but we do have a few that we're actively recruiting and part of that Reel of Hope.
Just for the record, throw that website out there so people at home can,
Sure, I can get that for you.
do you have it now?
Oh,
Or?
no, I don't.
Okay.
Jeremy, how is that being shared out? Like, how are these people finding out that it's there? How are you advertising?
Based on what I understand is it's advertised within the Foster Care Association, right?
We share it out. I've seen it come through the Ask Facebook group and any of the other Facebook groups associated with it. So I saw it broadly shared across Facebook, just all over the place. So I think Ask is pushing it out initially on behalf of the state and their recruiting efforts, but that's just what I think I know.
Sure. All right, and then last kind of unit that we have is Parent Aid Services. Parent Aid Services works with all the different units, whether it's Child Protection Services, in-home services, or foster care services. They just work directly with the parents, whatever their needs are. Right now, I have them also attending the motivational interviewing training coming up here soon. But we are also sending them to Grand Forks for a week-long training for Parent Aid Services. And then we're also working on implementing an evidence-based practice called Family Checkup. Family Checkup really, because currently our parent aides are not kind of providing an intervention that's an evidence-based practice. And the Family Checkup, it really looks at recognizing the strengths of the parents and really reinforcing the strengths of the parents and not really looking at the negative impact on what the parents are doing, but trying to make change happen through the strengths. So that's all I have for child welfare in the different units.
Any questions or comments for Jeremy? No? Okay, thank you, Jeremy. Very comprehensive report. Thank you for sharing out.
Thank you.
Next agenda item, other zone updates. Chelsea didn't have any zone updates for today. Tayon, do you have any?
No, she didn't leave any with me either,
Okay.
so unless there's any questions on anything specifically.
Anybody have any questions? Okay, hearing none. Moving on to public comment. This is the time anybody from the public can come up and make comment. Not seeing anybody here, I guess we'll move on to the next agenda item, which is other business. Anybody have any other business for tonight? No? Okay, hearing none. The meeting's adjourned.